Today I will be discussing Brian Mulligan's mobilization with movement technique to regain dorsiflexion range of motion. Objectives of this presentation are as follows. I will first discuss what the Mulligan concept is. I will highlight current research behind the Mulligan concept for increasing dorsiflexion and offer suggestions for future research. I will then show a demonstration of me performing a mobilization with movement of the talar crow joint. Then we will perform the technique together as a class. Brian Mulligan believes that a minor positional fall occurs following an injury resulting in movement restrictions and pain. When a correctional mobilization is performed, pain-free function is restored and several repetitions will begin to bring lasting improvements. A mobilization with movement is a concurrent application of an accessory mobilization with active physiological movement, meaning that the PT provides manual overpressure to the patient's talar crow joint while the patient is asked to actively dorsiflex their foot. This technique can be performed in weight-bearing and non-weight-bearing. All the patients in the 3 studies showed improvement in their dorsiflexion range of motion after a single mobilization with movement treatment. All of the 3 studies reported a p-value less than 0.05, indicating that there is strong evidence that there is a difference between the subjects receiving the Mulligan treatment compared to the control group. While a p-value informs readers whether an effect exists, the p-value does not reveal the size of the effect. That's why they use effect size as well. Effect size is a way to quantify the size of the difference between the 2 groups. Effect size is usually the raw mean difference between the 2 groups being the treatment group and the control group. Since the effect size using a 95% confidence interval encompasses 0, you can conclude that the 2 populations are not significantly different, meaning that there is a probability that a mobilization with movement treatment could have little to no effect. There is a discrepancy between the p-value and effect size because the p-value is dependent on the sample size. Each study consisted of a small sample size of 16 subjects or 23 subjects total, while the effect size emphasizes the significance of the effect rather than the sample size. Despite the improvements in dorsiflexion in the studies discussed, mobilization with movement treatments created a small to moderate effect size. It is not a surprise that a single Mulligan treatment resulted in small effect sizes because the full treatment effects of this intervention are typically seen over several sessions. Studies with the single treatment sessions combined with a low number of subjects thereby limits the treatment effects seen in the studies. Future studies should include patient assessment and follow-up after a series of Mulligan treatment sessions. Research should also explore the influence of this treatment on patient functioning during gait, postural control, and other movement tasks. Also, current studies are also only of the level 2 evidence, meaning that they are designed cohort studies or case control studies. However, to really investigate the effect of using the Mulligan concept as a treatment, randomized control trials should be performed consisting of longer treatment durations, longer patient follow-up period, larger sample sizes, and self-reported measures of function. These are my references, and here's my video demonstration.
Mulligan technique on the ankle to increase dorsiflexion range of motion. So first I would set up the belt around me, and it's going to come around the distal tib of the patient's ankle, and I have a towel here for comfort. The belt is going to be wrapped around my waist, and then as the lunges forward, this belt is going to be providing an anterior force to the distal tib fib, while I'm manually applying a posterior force to the talus while he's lunging forward and dorsiflexing his ankle. So I'm going to have you lunge forward. I'm going to be leaning back as he dorsiflexes.
So I would perform this a total of 10 repetitions and then reassess the patient's dorsiflexion range of motion to see if it improved. In my opinion, the Mulligan technique is effective at increasing dorsiflexion range of motion. But to summarize, research has shown positive outcomes when using Mulligan technique as a treatment to increase range of motion, though more research needs to be done to objectively quantify the effects of the treatment on patient outcomes.